training video. This demonstration is based upon our recommendations. However, Biodose is a flexible system and over time can be adjusted to your own policies and procedures.
This is an example of a standard 7-day or weekly tray. The tray has the service user information and photograph at the base, plus pharmacy and care provider information. The tray top surface displays the 28 doses labelled with intervals horizontally and days of the week vertically down the side. The dose pods are labelled with the service user's name, the contents of the pods, and the interval time. The trays can be set up for 7 days in a weekly format, 28 days, a monthly format, for PRN medication, or even controlled drugs. All tray types will display the service user name, pod contents, and interval times on the dose pods. Regardless of the format, the overall number of trays required for each patient is dependent on the variety of medication and frequency of their administration times. For every patient, you will receive a custom printed medication administration chart or MAR chart. MAR charts are the formal record of administration of medicine within the care setting, and every service user has one to correspond exactly to their drug regime. Always check this record when administering medication to service users to ensure the correct dose is being given, and fill in accordingly immediately after administering medication to the service user. This process should of course comply with your standard safety procedures. As the Biodose trays are checked in, they should be placed into the appropriate trolley or cabinet immediately. Biodose trolley is designed to store Biodose trays as well as non-Biodose products, for example creams, inhalers and eye drops. When not in use, the trolley should always be locked and attached to the wall, using the clamp provided. The trays are easily identifiable by the photographs and information on the ends of the trays. The trolley should be locked every time it's left unattended during the medication round. When pushing the trolley, always be careful of obstacles. Although there is a bumper strip around the base, the locks and keys especially are vulnerable and could be damaged if knocked against a door frame or scraped against a wall, for example. Take extra care when negotiating corners and always apply the brake when the trolley is stationary. As well as trolleys, a selection of cabinets are available in various sizes to suit a wide range of care settings. Administration of medicines from the Biodose pods must follow the guidelines in your medication administration policy to ensure that the right medication is given to the right resident at the right time. Firstly, remove the tray from the trolley by checking the service user details and photos on the ends of the trays, and then double checking the details on the surface of the trays. Identify the correct pod and then push out from underneath firmly and in one swift motion using 1 or 2 fingers. We would recommend that you offer the dose pod to the resident prior to opening to check that they will accept the dose. If it's declined, simply place the pod back into the tray and return after a short interval to try again. When the service user accepts the dose, simply peel off the pod seal and hand to the service user to take. When the dose has been taken, dispose of the pod and seal in the waste bag on the trolley. Recording on the MAR sheet must take place immediately after the medication has been administered. If a service user refuses their dose, record the details of the incident in line with your standard procedures, for example on the back of the MAR sheet. Fill in a refused medication label and place over the top of the dose pod from which the medicine has been refused, effectively resealing it, with the drug still inside. Place the pod back into the tray for the pharmacy to collect. With a liquid dose, dispose of the medicine in line with your standard waste disposal procedures before applying the refused medication label. Make ensure there are no medicines still in the pods. Remove any pod containing medicines for return to the pharmacy. These should be stored separately in a locked cupboard. Dependent on your in-house procedures, Biodose trays, after removal of confidential information, can be recycled with standard plastics, and pods should be disposed of as clinical waste. Seals from the pods and the seal on the actual tray carry confidential information and should be removed. Soak in warm soapy water to remove the ink and then dispose of accordingly. All this should be done in accordance with your standard confidential information disposal procedures. Biodose handy packs can be used when service users are taking time away from the site or for when community patients are on the move. The correct pods for the specific time frame of absence should be removed from the Biodose tray and inserted into the handy pack. Contact the pharmacy as soon as possible to advise them of any mid-cycle changes to a service user's medication. They will organise an appropriate solution, for example, to pick up the existing tray and return with the changes incorporated. Details for handling such a situation should be laid out in a basic service level agreement between the pharmacy and the care provider. New MAR or PIC sheets will be issued by the pharmacy when there is a change in medication. Controlled drugs can be supplied in Biodose trays on request, however the trays must be stored in a controlled drugs cabinet. The checking, administering and recording of CDs must comply with the home's medication administration policy. Short-term antibiotics and cough medicines may be dispensed into a separate Biodose tray, in which case a short-term therapy MAR chart will be issued. Medication remaining in the Biodose trays should be dealt with in accordance with the terms of the service level agreement with your pharmacist and in line with your standard waste disposal procedures. The Biodose system has a number of ways in which the medication can be linked to the service user. One of the most visual being a photograph printed on the end of every tray. For this, photographs need to be available digitally for the pharmacy to input into the computer system. Either the care provider or the pharmacy can take digital photographs of the service users. The files then need to be transferred either on the camera or another portable storage device to the pharmacy to be uploaded to the system. We would suggest that a full printout of all the photographs is made with the service user names so that these can be checked and agreed between the pharmacy and care provider to ensure that the images match the corresponding service user. This document should be retained as a final check by the pharmacy and care provider. Please note, a consent form should be completed for each service user to allow a photograph to be taken and used as identification on the Biodose trays and paper. Provide the pharmacy with all relevant information required for dispensing prescriptions. This should include the following: current MAR charts, care provider details and address, care provider administration times, service user addresses, service user's dates of birth, the service user's GP, and also the service user's floor, ward, and room number if applicable.
Watching the Biodose training video. If you have any questions, please contact your pharmacy directly or contact us here at Biodose on the number on your screen. Thank you.